Hello, this is Dr. Doug Endel with Atlas Rising, and today I want to give you a short, really practical breakdown of lower back pain. If you want more in-depth explanation of what we're going to talk about today, check out our podcast on Spotify or our YouTube channel. But because back pain is one of those things that almost everyone deals with at some point, it's one of the most common reasons people end up in a chiropractic office, a medical office, urgent care, physical therapy, or unfortunately, sometimes even in surgery. And here's the thing that I want to start with. Lower back pain is not just lower back pain. That sounds really simple, but it's really important. Two people can walk into the office and both say, my lower back hurts. And they may have completely different problems. One person hurts when they sit, one person hurts when they stand. One person feels better leaning forward, one person feels worse bending forward. One person has pain down the leg. One person only has pain across the lower back. One person feels like their back is giving out. Another person feels stiff and locked up first thing in the morning. Those are not all the same issues. And if we treat them all the same, we're probably going to miss the real problem. And so today I want to walk you through the main types of lower back pain we see in the office, what they tend to feel like, and then we can go into what we do about them. So because the goal is not just temporarily calm the symptoms down, the goal is to figure out what is causing the pain, what category it falls into, what tools we need to use to actually correct the pattern. So let's dive into that. The first type of lower back pain is disc-related pain. This is the one a lot of people worry about right away. They'll come in and think and say, I think I slipped a disc, or I have a bulging disc, or my MRI says that I have a herniation. And discs can absolutely be a major source of lower back pain. The discs sit between the vertebrae, and they act like shock absorbers. And I usually describe it like a jelly-filled cushion. They help create space, absorb the load, and allow the spine to move. But over time, if the spine is under too much pressure, if the curves are off, if someone sits all day, lifts poorly, has old injuries, or has degeneration, then those discs can start to compress. And this is just like squeezing a balloon. That pressure has to go somewhere. And that's when we start to see bulges, herniations, disc degeneration, and classic disc symptoms are usually worse with sitting, bending forward, coughing, sneezing, or bearing down like you're using the bathroom. And a lot of times there can be pain into the butt, hip, down the leg. That radiating pain is one of the classic clues that a nerve might be involved or being pinched. And now one important thing, just because an MRI shows a bulging disc, that does not automatically mean that that's where your pain's coming from. There are people walking around with disc bulges and no pain at all. So imaging matters, but it also has to match the symptoms and what else we're seeing with the exam. And that's why we don't just treat the picture. We actually treat the person. And so for disc issues, one of our most powerful tools is spinal decompression. Decompression is different than just stretching. It's not just yanking on the spine and holding it there. A true decompression table gently pulls and releases in a very specific way, almost like a pump. And that pumping action helps open up the disc space, reduces pressure, and encourages fluid and nutrients back into the disc space. And so, no, not just drinking more water, it does not hydrate the disc. I wish it were that easy. I tell everyone, go drink a gallon of water and your disc will be fixed, but that's not how it works. Discs need motion, proper loading, and reduced pressure, and that's where decompression can be a really big game changer. We might also use chiropractic adjustments, but usually very strategically. With an active disc issue, I'm often looking at the whole spine and posture, not just aggressively adjusting the painful area. Another therapy called cold laser can be a great tool to help reduce inflammation and support tissue healing. I'll also use Trigenics, which can help the muscles and guarding patterns around the injury. And so for disc pain, the solution might include decompression, specific chiropractic, cold laser, Trigenics, and then eventually movement and strengthening when the body's ready to. The second type of lower back pain is called facet or arthritic pain. The facets are the joints in the back part of the spine. They're like the guardrails of the spine. They help control motion and prevent you from moving too far in one direction. But when those joints get compressed over and over again, they become irritated, inflamed, arthritic, and painful. And this is really common in people who have a big arch in their lower back, sometimes called sway back, or people who stand and walk with the low back compressed. It's common with degeneration and arthritis. So facet pain usually feels like pain across the lower back. It typically does not shoot down the leg. It may feel worse when standing or walking or leaning backwards, and it feels better when you're sitting or bending forwards. So this is the person who says, I can sit and feel okay, but if I stand too long, my back starts to kill me. Or walking through the grocery store is awful unless I lean on the cart. Now, the grocery cart example can also overlap with stenosis, which we'll be talking about in a minute, but it's a big clue that extension and standing posture are part of the issue. And so with arthritic and facet-related pain, we want to do a few things. First, we want to reduce that compression that's happening on those joints. That may include decompression, chiropractic adjustments, posture correction. Second, we want to improve how the spine and pelvis are moving. And then third, we want to look at the foundation. This is where people sometimes get surprised because when someone comes in with lower back pain, one of my first questions is, do you have any issues with your feet or ankles? And they'll look at me like, why are you talking about my feet? My back hurts. But if your arches are collapsed, if your weight distribution is off, if your feet are not giving you the stable foundation, then this changes how your knees, hips, pelvis, and lower back move. And so over time, that can create more stress in the spine. And so for some people, custom orthotics might be part of the solution. Not because orthotics fix every back problem, but because for the right person, they help correct the foundation that's feeding up into the lower back stress. The third type of back pain is muscular or soft tissue pain. This is where most people hope they have when their back starts hurting. They'll say, I think I just pulled a muscle. And sometimes they did. Muscle-related back pain is usually dull, achy, tight, sore, spasm-like. It often happens after yard work, lifting, twisting wrong, working out, raking leaves, shoveling snow, doing something the body wasn't really prepared to do. But here's the important part. Muscles usually tighten for a reason. The muscle may be the thing you feel, but it might not be the root cause. Muscles often guard to protect the joints, discs, nerves, or unstable areas of the spine. So if your lower back muscles are constantly tight, it might not mean you just need more stretching. It might mean your body is trying to stabilize something. And that's where the exam that I do matters a lot. For muscular pain, we might use a soft tissue work called Trigenics, stretching, mobility work, maybe some chiropractic adjustments, and then a lot of core stabilization. I'm a big fan of stability work for the lower back, not just random ab exercises, not just crunches, not destroy your core workouts, but really smart stabilization. The trunk is like a tube. If one side is tight, one side is weak, one side is overworking, the whole system is unstable, and the spine ends up taking too much of that load. And so we want to restore that balance, mobility, and strength around the entire system. The fourth type of back pain is nerve compression or spinal stenosis. So spinal stenosis means narrowing. We're usually talking about narrowing around the spinal canal or around the opening where the nerve exits the spine. So when the opening gets too small, the nerve can become irritated or compressed. And the symptoms might include or feel like sharp pain, burning, tingling, numbness, weakness, pain traveling down the leg. The classic stenosis patient often feels better leaning forward. That's the person who says, I'm okay if I lean on the shopping cart, but if I stand up straight or walk too long, my back starts and legs start killing me. The forward bend opens the space a little bit and can temporarily reduce some of that pressure. And stenosis is often connected to other problems like disc degeneration, arthritis, bone spurs, facet joint compression, postural changes. So it's rarely just one thing. With nerve compression, we want to reduce inflammation around the nerve. We want to create more space if that's possible. We want to improve how the spine is functioning. So decompression can help if the stenosis is partly disc-related or space-related. Cold laser can be very helpful for nerve irritation and inflammation. Chiropractic care can help restore motion and reduce some of that stress. Trigenics can help calm the guarding patterns around that. And posture and stability work might be very important long-term. The fifth type of back pain is instability. This is the person who feels like their back catches, slips, gives out, locks up. They might have pain rolling over in the bed. They might have pain going from sitting to standing. They might feel like they have to move really carefully because one wrong motion will set the back off. And instability is not always dramatic on imaging. Sometimes it's functional. The spine might not be stabilizing well because of muscles, joints, ligaments, nervous system are not coordinating properly. So these patients often need less aggressive stretching and they need a lot more stabilization. And that's important to understand that difference because if something is unstable, constantly stretching might actually make it feel worse. The body might respond by tightening even more to protect itself. And so the solution is often specific chiropractic care, Trigenics, some controlled mobility, and then progressive stability work. So it's not just go strengthen your core, right? That's way too generic. We want the right exercises at the right time in the right sequence. And the sixth type of back pain is postural lower back pain. And this is huge now. People are sitting all day. They're working at computers, they're driving, they're looking down at their phones, they're not moving enough, and then they wonder why their back doesn't feel good. Now, I don't like oversimplifying it by just saying sitting is the only problem, but prolonged sitting and poor movement variability absolutely matter. So if you sit 8 hours a day, 5 days a week for years, your body's going to adapt to that position. The hip flexors tighten, the glutes shut down, the middle back starts to stiffen up, the lower back compensates, the head and shoulders start to move forward, the pelvis changes position, and eventually the lower back starts complaining. So postural pain might feel achy, stiff, compressed, tired. It might feel worse after sitting, might feel worse after standing, or being in one position for too long. The solution here isn't just sit up straight. That advice is almost useless by itself. Posture is strength, posture is endurance, posture is mobility, posture is breathing, posture is how your nervous system organizes your body in space. So in the office, we might take posture pictures, measure where someone is starting at, and then reassess over time. We use specific adjustments, decompression if needed, orthotics when appropriate, and corrective exercises based on what the person's body is actually showing us. And so those are the 6 main categories. We've got disc pain, facet or arthritic pain, muscle and soft tissue pain, nerve compression or stenosis, instability, and then postural pain. And here's the thing. A lot of people have more than one of those. That's why a one-size-fits-all approach does not work. Somebody might have a disc bulge and instability. Someone might have stenosis and arthritis. Someone might have posture problems and muscle guarding. Someone might have flat feet feeding into lower back compression. So the goal is not slap a label on it and call it done. The goal is to identify the main drivers and build the plan on top of that. So at Atlas Rising, the tools we might use include spinal decompression, Blair upper cervical and full spine chiropractic care, drop table adjustments, arthrostem, Trigenics, neuromuscular therapy, cold laser, PEMF, custom orthotics, posture analysis, corrective exercises, and then lifestyle guidance. Disc health. Chiropractic care helps restore better alignment, better motion, and better nervous system input. Trigenics helps reset that muscle activation and reduce guarding. Cold laser helps with inflammation, nerve irritation, and tissue repair. PEMF helps support circulation, healing, and inflammation control. Orthotics help when the foundation is contributing to the problem. And then posture and instability may help make the changes. So if you're dealing with lower back pain, I want you to ask better questions. Does it hurt more when I sit? Does it hurt more when I stand? Does it travel down my leg? Does leaning forward help it? Does bending forward make it worse? Does my back feel unstable? Is it worse first thing in the morning? Is it worse after being at the computer? Do I have foot or ankle issues that might be affecting the foundation? Those answers all matter. And they help us figure out what category you're in and what solutions might make the most sense. So the big takeaway is this: back pain is not random. It's usually your body's way of saying something is not moving, loading, stabilizing, or healing the way that it should be. And then once we understand that, we can stop guessing. At Atlas Rising, our goal is to help you figure out what exactly causing your pain, and then use the right tools to help your body reset, stabilize, heal, and function better. Because lower back pain can steal a lot from people. It can affect your work, your workouts, your sleep, your mood, your parenting, your confidence, and your ability to enjoy your life. And you don't get extra bonus points for suffering longer. If your lower back pain keeps coming back, if it's limiting your life, if you're tired of managing it instead of correcting it, we'd love to help you take a deeper look. Schedule a consultation with me, and we'll spend about 45 minutes to an hour going through all of this in detail and make sure that we get to the bottom of what's going on so you can get back to living a life fully lived.